Hey, I'm Quincy. I'm a nurse practitioner student, and I'm going to be doing Gesner's cardiovascular assessment today. Hey, Gesner, how's it going?
Good. Quincy, how are you?
I'm doing very well today. I'm going to be your nurse practitioner, and so I'm going to assess your heart today. How have you been feeling lately?
Been feeling pretty good. I work out, go to the gym, but
How many days a week do you work out?
uh, 6 days a week.
That's great.
Yes.
Sometimes we can do a little bit too much and get tired. I heard you were a little tired lately.
Yes, going up the stairs. So I live in the third floor of my apartment, and
Mhm.
there are no elevators, so I have to walk up the steps multiple times a day, and sometimes it can get a little.
What about when you're working out? Have you been short of breath at all when you do that?
No.
That's good. All right, great. Yeah, so you drink plenty of water, and how's your diet?
I should drink more water, honestly, but I I really don't. Maybe I'll drink maybe 2 bottles a day or three.
Okay. Well, one of the first things that I'll do is I'll listen to your heart. Just want to see how it's sounding, make sure everything sounds normal. Have you noticed any fast heartbeat?
Uh, yes, I have in the
Mhm.
past couple of weeks, but lately it's been pretty good. But I think it has to do with maybe stress at work. But
Okay.
I think okay.
So do you feel this rapid heartbeat at work or when you're at home laying down?
Uh, Actually at home, I would check on my Fitbit, and it would be like 112, 113.
Okay. All
And
right.
then when I'm talking to my girlfriend too, so
Yeah.
heart rate goes
I
up
guess that could bring your heart rate up. That might be a good
depending
thing.
on conversation.
All right. Well, I'm going to listen to your heart. We've already checked your vitals, and your vitals today look great. Your blood pressure is normal. Your heart rate's normal. It's actually 77. So that's really good. And as you exercise more, your heart rate will actually slow down because your heart gets stronger.
Okay.
Okay. So I'm going to take a listen here. I got to listen in several spots. So if you're uncomfortable at any time, just let me know. Okay.
Okay.
All right. I'm assessing his pulmonary valve, and I'll assess with both the diaphragm and the bell of the stethoscope. S1 and S2 is heard. No clicks or abnormal heart sounds. No S3 or S4. Listening to his aortic valve. S1, S2 heard. Listening to Herb's point. S1, S2 heard. Tricuspid valve. Now listening to his mitral valve. And at this point, I've already assessed my patient from a distance and checked for any edema in his lower extremities or in his toes or in his fingers. And I'll check capillary refill. Can you stick your hands out for me like this? His cap refills are 2 plus. Everything looks good. I would do the same with his feet. And all of that looks good. Can you lay back for me? At this point, what I'm looking for is to see if his jugular veins are distended when he is laid back at a 35-degree angle. And so I would actually feel and I would check his pulse, and then I will auscultate and try and listen for a bruit. All right, so I'm going to feel your pulse, and I'll just feel one side at a time so you don't feel like I'm choking you.
Okay.
All right. Pulse is good on both sides with no thrill. I'll listen to his jugular veins with the bell of the stethoscope. I'll do the same with his temporal arteries. No thrill felt in temporal arteries or in jugular veins. No bruit. All right, so all that looks good. Now I'm actually going to listen to some arteries in your stomach and in your legs. Make sure that they also sound good, that there's no obstruction that can be heard throughout, okay?
Okay.
I'm listening to his renal arteries, listening to his aorta, iliac arteries, all right, now I'm going to listen to your legs here, and I'm going to be feeling right around your groin. Let me know if you're feeling comfortable, okay?
Okay.
Femoral arteries sound good. No thrill. I'm going to now feel for your pulses. Femoral pulses are also good. No thrill is felt. No bruise heard. All right, Gensler. Well, all of this looks good. Everything looks very normal. Sometimes the Fitbits, maybe they don't read accurately, but another thing that can happen is sometimes when we get real anxious, we can have a fast heartbeat. Sometimes we'll feel real comfortable when we're going to sleep. You said that you noticed this at home. What time do you usually notice?
Well, it doesn't happen every day. Kind of like what you mentioned. If I had like a stressful day at work, a long day, then if I just happen to check it, then yeah, it might be up a little bit. But besides that, I don't check it.
Do you have any heart history, health-wise? Have you ever had any heart problems?
Nope.
Do you ever had any medications? Do you take any medications?
Nope.
Okay. Are you allergic to any medications?
Nope.
How about for anxiety? Have you ever been treated for anxiety?
Nope.
Okay. All right. Well, at this point, everything looks good. What I'd like you to do is if you continue to notice these things throughout the next few weeks, I'd like you to come back and see me. But a couple things I'd like you to try is maybe some meditation. I'm going to give you some information on that. So when you come home from work, you can try and relax and unwind and de-stress. Okay. There's also some different teas that you can take to help you relax before bedtime. And that may help you to notice that your heart rate is staying down lower when you're not as anxious. Okay.
Okay.
All right. It was great to work with you. Thank you.
Thank you, Doc.